Have you ever come across someone who is a known asthmatic and then in serious respiratory distress, panting for air before? In today's video, I would want us to look at asthma into details. In fact, we will go deep into what asthma is and then everything you need to know about asthma. So let's move straight into this very topic. I am OWUSU KOJO Emmanuel, a physician assistant by profession and then a minister of God. If there's any health topic you would want me to make a video on, drop that topic into the comment section and I'll be glad to make a video on that. Now let's go. Breathe in, breathe out. Have you noticed that you are breathing very well? But in today's video, I would want to explain to you about a kind of medical condition which when you have, it is very difficult for you to breathe very well. Now, this medical condition is called asthma. Before we look at asthma, I would want to explain to you about the mechanism of how the respiratory system operates. So due to this, I drew this small sketch and I hope that this small sketch helps us to get the understanding of how the respiratory system operates. Now, whenever you breathe in like this, air passes through this tube. This tube is called trachea. Then the air will pass through this small division. So the trachea will divide into these small tubes. These two small tubes are called bronchi. You understand? Then this is one lung. This is also another lung. So the air passes through the trachea, then passes through the two bronchi, then it will enter the lung. You understand? Inside the lung, we have a small division called bronchioles. So the bronchi will divide into small bronchioles. Then finally, it will end up in the alveoli. So this is one alveoli. This is also another alveoli. This is also another alveoli. So this is how air moves in and out of the respiratory system. Now let us talk about asthma. When asthma occurs or when somebody is diagnosed of asthma, it means that the person has an affected bronchi because asthma is a chronic inflammatory condition of the bronchi airway. So when somebody has asthma, it means that the bronchi has been affected. The two bronchi have been affected. Now, when somebody has asthma, a lot of us have misconception or lies about asthma. Now, the first lie about asthma is that asthma can be cured. No, asthma is a chronic condition like having hypertension or diabetes. So when somebody is diagnosed of asthma, it means that the person will live with the asthma the entire life. You understand? So the symptoms can resolve or the symptoms can reduce, but that does not mean that you have been cured of asthma. Also, a lot of people think that asthma is contagious. That is not true. Asthma is not like COVID-19. It's not like pneumonia. It's not like common cold. You cannot transfer asthma to a different person when the person is very close to you. No. Now let's look at the symptoms. What you will notice when somebody has asthma. The first one is cough. Cough is associated with many respiratory conditions. The second one is difficulty in breathing. The third one is chest tightness. So you experience tightness in your chest. Then the fourth one is wheeze. Now many people don't know about this wheeze. Now let me explain the wheeze. When you get closer to a person have asthma and the symptoms start coming, you notice that when a person breathes, you hear a sound. When a person breathes out, you notice that a sound comes and the sound is very high sound. You understand? Because normal breathing shouldn't produce that high pitch sound. Let me do this example. When you are breathing in and out, have you noticed that there is no high pitch sound? But when somebody has asthma and the person is breathing out, you notice that a high pitch sound is being produced. So these are the symptoms of asthma. You understand? Now somebody will ask that, how do it happen that somebody gets this asthmatic attack? There are something we call precipitating factors or predisposing factors. When the person having asthma gets closer to these predisposing factors, it makes the person have this asthmatic attack. There are certain kind of things we call allergens. These allergens include perfume, animal fur, cockroach droppings, fowl droppings. You understand? When somebody gets close to these kind of allergens, the person will get the attack. Also, when you have asthma, you shouldn't do a lot of exercise because strenuous exercise too can make the asthmatic attack also come. Some drugs like NSAIDs, aspirin, is also a predisposing factor to getting asthmatic attack. So if you have asthma, it is advisable that all these kind of things you know drive yourself away from it, because it can predispose you to getting the asthmatic attack. Now let us look at how do you manage asthma. When somebody have asthma, how do you manage the asthmatic attack so that the person will reduce the risk of getting the symptom? The first one is that when somebody get the attack and goes to the hospital, because the person find it difficult to breathe, we give the person oxygen. Then we also target the two bronchi. The two bronchi, we target it and give a medication called bronchodilator. The bronchodilator expand the two bronchi so that the bronchi air will be able to pass through the two bronchi. You understand? Then the third medication is steroids. The steroids is there to reduce the inflammatory processes going on, because asthma is an inflammatory condition. I hope you understand. So this is the information I want to relate to you about asthma. I know for sure that the lies and the truth about asthma, you have gotten that in today's video. Share this video to a friend and a family member. Also subscribe to this channel for more videos and like this video.